Hello everyone, Brahmu here for you to share the content on Huntington's disease. So, this is coming under the unit 3 genetic conditions of adolescent and adults under genetic subject. So, in this session, we'll be going into the glimpse of Huntington's disease. As we all know, Huntington's disease is a progressive inherited degenerative brain disorder that produces physical, mental, and emotional changes and causes the progressive breakdown of the nerve cells of the brain. So, here in this disease, what happens is that it is associated with cell loss within the basal ganglia and cortex. So, when you go through this picture, you can see that there is total atrophy of the basal ganglia as well as enlargement of the lateral ventricles, which causes the neuron also to degenerate. Hence, patient is mostly exhibiting the symptoms of chorea, which we call it as the involuntary movement, which is being associated with the condition, and we can coin it as it is the jerky dancing movement. So here the disease is termed as a condition more with lots of abnormal movements. So we can otherwise call it as a movement disorder. So coming to the introductory part of Huntington's disease. Huntington's disease is a progressive brain disorder that causes the breakdown of nerve cells in certain areas of the brain. So here the child with Huntington's disease inherits the Huntington's gene, which eventually develop into illness. So, genetic testing can diagnose the Huntington's disease at every stage of life cycle. So, here this disease can be defined as the basal ganglion disease, which causes hyperkinetic movement disorder, which we call it as chorea. Patients are having mental abilities or changes which decline to either dementia, depression, apathy, or impulsivity. So, here either the client is going for total lack of awareness as well as forgetfulness, or either they isolate themselves and go into a depressive state, or they show no reaction, which we call it as apathy, or sometimes they are very much irritant to environmental stimuli, which we call it as impulsivity. So, what is the major factor for contributing Huntington's disease? Is that it is an autosomal dominant disorder. So far we were seeing about the recessive disorder. So, in this case, it is an autosomal dominant disorder where the client is developing either through hereditary disorder, that is through gene makeup from one copy of parent to another. Hence, therefore, a parent with defective Huntington's gene can pass the defective copy of the gene to the other offspring as well. So, here the major early symptoms would be the patients are having moodiness. Moodiness in the sense they are having changes in the concentration, forgetfulness, memory might be decreased, and patient can have poor judgment. They are unable to make decisions or answer questions. Fidgetity, that is involuntary movement of the extremities. So patient can have a movement of either fingers, feet, or trunk, which we call it as tics. And here patient is also having changes in the cognitive personality aspects. Some cases are going in for trouble seeing, that is the sight is totally affected. So some of the clients are also having emotional symptoms such as irritability, lack of energy, bipolar disorder, or they also have ongoing disinterest in life. That is, they don't have any interest towards the external environment and situations. So the diagnosis can be made through detailed history collection, physical examination, neurological assessment, psychiatry assessment, as it is involving more of psychiatric behavioral changes, and for confirmatory of the basal ganglionic cells, we can screen in for CT scan and MRI. So as of now, there are no currently founded what is it the treatment. There are no treatment to alter the course of Huntington's disease. The only thing we focus on to reduce the symptom, prevent the complication, We can assure the patient by giving good support and assistance to the patient as well as to the caregiver. So the medications here we give in for controlling the symptoms. So the common drug of choice is that terabenzine, antipsychotic drug and other drugs which will help to keep the patient's activity, that is the chorea movement and other. We can also start in for the nutritional therapy, like starting with thickening agents, because the clients are refusing to eat due to the involuntary movement and they are not able to easily swallow. So, high risk for choking as well. So, in those cases, we can give some food in the form of soups, and also we can educate the parent and the child and the child caregiver to eat slowly and as well as smaller chips of fluid to prevent choking. And if eating is totally impaired through mouth orally, then we have to go in for percutaneous endoscopic gastrostomy. The medications of choice, as I told you earlier, it is terabenzine, amantadine, antipsychotic drug, benzodiazepines, anti-Parkinson's drug, valproic acid, and pantenoic acid, and SSRI, which is selective serotonin reuptake inhibitors. So, as here in this condition, the patient is more prominently showing of the symptoms of psychiatric changes. So, patient will be on antipsychotics and some sort of antidepressants. According to the symptom, the drugs will be onto